Now, some tragic news from Hyderabad, where the head nurse of the Government General and Chest Hospital died of COVID-19. She passed away just 4 days short of her retirement. This is the first nurse that Telangana has lost to coronavirus. She had in fact taken leave to look after her pregnant daughter, but had returned to work after there was a shortage. Uma Sudhir reports.
This is the first case of a nurse in Telangana succumbing to COVID-19. This was a head nurse at the Government Chest Hospital in Yerragada, and she was on 15 days medical leave, and because of the staff crunch, she was called back. We are told that her daughter is in fact pregnant and wanted to extend her leave. The nurse wanted to extend her leave, but because of the staff crunch, they had called her back, and she seems to have come in contact with the virus at the COVID ward where she was in fact put on duty, and subsequently, because she tested positive, was running high temperature and had certain other complications, she was sent to Gandhi Hospital, where she had to ultimately be put on a ventilator but couldn't survive. This case comes even as the government is worried about the increase in numbers. Health Minister has said these numbers are expected to go up even further, but they believe that the kind of positivity rates that are being reported, already Telangana is reporting about 16% positivity rates, and after the tests were ramped up from the 15th of June onwards, some days the positivity has been as high as 25%, which means 1 in every 4 people being tested was in fact turning out to be positive, and that's the reason why the government conducted an inspection of all the private labs. An expert team was sent into 16 private labs, and they have found some serious lapses in the functioning. One, in the infrastructure, in the human resource training, in the quality standards being followed, in the hygiene and sanitation as well in these hospitals, and also in the reporting of the numbers that they have done. One of the major things that they have spoken about is that the staff there was not wearing the private protection, personal protection equipment, and therefore the staff was being exposed to the virus as well, and there were no safety cabinets, and hygiene was poor, and the personnel was not trained properly in fact to conduct the test, and quality control and validation of tests was not followed in some labs. They said in some labs in fact the samples had in fact been pooled, and if the pooled sample was testing positive, they're declaring everyone as positive, and that could lead to some false positive results. There was disparity in the kind of numbers that were uploaded, 1 in the ICMR portal, 2 in the state portal, and 3 in the lab results itself. If I just give you this example of the overall numbers, in the test done as per the labs, there was 12,700. As per the ICMR portal, there was 9,500. And as per the tests reported on the state portal, there was 6,733. So the expert committee has now given its report, and we are expecting that the government may in fact take stringent action against at least some of these laboratories.